Welcome everyone. Today we are delving into the world of healthcare, focusing on a topic of global importance, healthcare disparities. These disparities refer to the differences in health outcomes and access to healthcare services among different populations. This implies that where you live, how much you earn, or your racial or ethnic background could potentially affect your health status and access to quality healthcare. These disparities are not isolated within a particular country or region. They exist on a global scale. From the bustling metropolises to the remote rural areas, from the affluent neighborhoods to the impoverished slums, disparities in healthcare are a harsh reality. Factors such as socioeconomic status, race and ethnicity, and geographic location are major contributors to these disparities. For instance, disadvantaged individuals are more likely to suffer from chronic diseases and have poorer overall health. In summary, healthcare disparities are differences in health and healthcare that are closely linked with social, economic, and environmental disadvantage. Understanding these disparities is not just a matter of fairness, it's a matter of global health security. Now that we've introduced the concept, let's delve into the impact of these disparities. Healthcare disparities have a profound effect on individuals and communities. Those who are disadvantaged, often due to factors like socioeconomic status, race and geography, are more likely to suffer from chronic diseases such as diabetes, heart disease and cancer. They are also more likely to have poorer overall health. This can be attributed to a lack of access to healthcare services, including preventive care, which can detect health issues early and provide necessary treatments. But these disparities go beyond individual health outcomes. They also impact communities and nations as a whole. Imagine a community where many are suffering from chronic diseases. The productivity of such a community is likely to be hampered, reducing its economic strength. The ripple effect of this can be seen in the overall health of the nation, affecting its socio-economic development. Now, let's take a global perspective. Healthcare disparities exist not only within countries, but also among different countries. Some nations struggle with limited resources and inadequate healthcare infrastructure. In these countries, access to basic healthcare services can be a luxury, not a given. For instance, in some parts of the world, a simple act of getting vaccinated can be a monumental task due to lack of access to healthcare facilities. The impact of these disparities is significant. They lead to a vicious cycle where the disadvantaged become more disadvantaged, and the gap between the health outcomes of different populations continues to widen. And what about the global community? Well, in an interconnected world, the health of one nation can impact others. In the face of a global pandemic, for instance, healthcare disparities can make it difficult for some nations to manage the crisis effectively, which can have global implications. These disparities have a significant impact on the lives of individuals, communities, and nations. It's clear that these disparities pose a major challenge, but there are strategies to address them. To begin, improving access to healthcare services is key. This could involve expanding coverage in areas with limited resources, or making services more affordable for disadvantaged individuals. It's about ensuring that everyone, regardless of their socioeconomic status, race, or geography, has the same opportunity to receive quality healthcare. Next, addressing the social determinants of health is crucial. These are the conditions in the environments where people are born, live, learn, work, play, worship, and age, and they have a profound impact on health outcomes. By improving these conditions, we can help level the playing field and promote better health for all. Promoting cultural competency in healthcare is another important strategy. This means training healthcare providers to understand and respect the diverse cultures they serve. By doing so, we can help ensure that everyone feels comfortable seeking care and that they receive the most effective treatment possible. Technology also has a role to play in reducing health disparities, particularly telemedicine and mobile health applications. These tools can bring healthcare services directly to those who may have difficulty accessing them otherwise. However, it's crucial that these technologies are accessible and affordable for all populations. They should not become another source of disparity, but rather a means of overcoming it. In conclusion, while there is no one-size-fits-all solution, these strategies can make a significant difference in reducing health disparities. By striving for improved access, addressing social determinants, promoting cultural competency, and leveraging technology wisely, we can help ensure that everyone, no matter where they come from or what circumstances they face, has the opportunity to achieve the best possible health. While there is no one-size-fits-all solution, these strategies can make a significant difference in reducing health disparities. We've discussed the problem and potential solutions, but why is it so crucial to address these disparities? Well, the importance of addressing healthcare disparities goes beyond just improving individual health outcomes. It's about enhancing public health and securing global health. You see, when we have groups of people who cannot access quality healthcare, or who suffer from chronic diseases at a higher rate, it negatively impacts the health of our entire society. Think about it this way. We are all interconnected in this global village. The health of one person, one community, or one country can influence the health of others. Diseases don't respect borders, and in our increasingly interconnected world, a public health issue in one part of the globe can quickly become a global concern. By striving to reduce health disparities, we're not just helping individuals, we're strengthening public health systems, improving global health security, and contributing to a healthier world. Moreover, addressing disparities is about justice and equity. It's about ensuring that every person, regardless of their socio-economic status, race, ethnicity, or geographic location, has the opportunity to live a healthy life. It's about creating a world where quality healthcare isn't a privilege for a few, but a right for all. In the end, reducing health disparities is a long journey, one that requires commitment, collaboration, and a clear vision. But it's a journey worth taking. In the fight for better health for all, addressing healthcare disparities is a global imperative. As we wrap up this discussion, let's reiterate some key points. We've examined the global landscape of healthcare disparities, understanding their impact on populations worldwide. We've highlighted the importance of addressing these disparities, with strategies such as improving healthcare access, addressing social determinants, and promoting cultural competency in healthcare. Technology, like telemedicine, can play a crucial role, but it must be accessible and affordable for all. In the end, tackling healthcare disparities is about creating a world where everyone, no matter who they are or where they come from, has access to quality healthcare. Thanks for watching, and remember, global health matters.